Hey everyone, and welcome to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Golinvaux, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on my YouTube channel. And as always, the original article with its associated images will be linked in the show notes below. So without further ado, let's get into this week's article titled, Ice, Maybe, a Surgeon's Perspective on Icing Injuries. I recently received an intriguing question from one of my readers. Is it good or bad to ice my ankle after I sprain it? I always thought yes, but I had a coach growing up who said, never ice an injury. Great question. So while most of us might assume that the answer is a resounding yes, after all, that's what we've always done. There's a vocal minority arguing that icing an injury is actually a damaging approach. So it sounds like it's time for a deep dive. Let's start with why do we use ice? Icing acute injuries entered the mainstream use in the 1970s when Dr. Merkin proposed the RICE protocol, rest, ice, compression, and elevation, in his book, Sports Medicine. Since then, it's been a staple on NFL sidelines, MLB locker rooms, and Saturday soccer sidelines. But why? Studies have shown that applying ice to an injury will, unsurprisingly, cool the underlying soft tissues. This cooling effect leads to several changes in our anatomy and physiology. It constricts the blood vessels, which reduces bleeding and swelling. It decreases enzyme activity, which potentially limits secondary tissue damage from free radicals generated during inflammation. And it slows nerve signal conduction, thus numbing the area and reducing pain. These all sound great, right? So what's the big deal? The case against ice. So let's let the opponents enter the ring. Do you remember my previous article on inflammation? If so, you may recall that our body's inflammatory process has evolved over millions of years to stop bleeding and heal just about any injury we encounter. Think of those pesky saber-toothed tigers who were chasing our ancestors. The anti-icing camp asks the question, why on earth would you want to halt this natural process of inflammation? They argue that applying ice to an injury only inhibits our natural healing ability, slows down recovery. Their reasoning parallels the above list of physiology changes and goes something like this. Constricting blood flow to an injured area could cause more tissue damage as cells starve for oxygen. Inhibiting inflammatory enzymes blocks the natural healing process we've evolved over millions of years for this very purpose. And slowing nerve conduction could result in long-term nerve damage if cold exposure is prolonged. This argument makes sense in principle. We know that icing can slow down these processes at each step, but does it actually cause a cumulative detriment to healing? What does the evidence tell us? When a good old-fashioned medical duel like this takes shape, the best approach is to dive into the evidence. Imagine that. However, we must be cautious when interpreting results, as a slight spin could tip the scales one way or the other. It's also important to note that the quality of evidence in this realm is sort of average at best. This issue is similar to studying nutrition. There are numerous variables at play when healing from an injury, and the use of ice likely has only a modest effect. This makes it challenging to determine with certainty how effective or harmful icing might be in any given situation. So here's what we know. Several studies have evaluated pools of research looking at ice application after injury and after surgery. They found wildly different results from study to study, ranging from improved pain scores and range of motion to completely ineffective icing. Importantly, no evidence of harm from icing was detected across these studies. Perhaps our best evidence actually comes from knee replacement surgery patients. This surgery and the post-operative rehab protocol are highly standardized, allowing us to study the effect of changing a single variable a little bit more easily. We can ask a simple question. What happens to patients who use ice after a knee replacement compared to those who don't? Several studies have actually addressed this question, and the results are intriguing. In general, patients who used ice after knee replacement had shorter hospital stays, were able to get up and walk sooner, experienced less blood loss, and used fewer narcotic pain medications. However, there was little to no indication that those who used ice healed any faster or had any better long-term outcomes. Crucially, there was also no evidence that they healed any slower because of their ice use. So who should we believe? I actually think both sides present valid arguments, but for me, the knee replacement literature is pretty convincing. Why? because if you've ever seen a knee replacement surgery, you know it is one of the bloodiest, high trauma procedures imaginable. The degree of bone and soft tissue damage is actually sort of wild, and we have the data to prove it. The inflammatory blood marker levels, otherwise known as a C-reactive protein, after a knee replacement skyrocket, often higher than those seen when a patient develops a body-wide infection known as sepsis. And it makes sense. We literally saw off the ends of the femur and tibia to fit the replacement parts. This is our modern-day saber-toothed tiger attack. And what convinces me about this literature is less about the benefits of icing. Yes, faster walking rates, quicker hospital discharge, and less narcotic use are great, but it's more about the lack of downside of icing. Nowhere in any of these studies did they find something like, well, initial recovery was better, but by 2 months, these patients were all much slower to heal. So while I completely understand the logic of the anti-icing community and the desire to let the body's natural inflammation process work, if you take patients who have undergone this incredibly traumatic surgery, i.e. a knee replacement, you would expect to see some serious differences in their quote-unquote slowed healing response after icing. And that scientific proof, it just isn't there. Okay, so what's the answer? I'm going to tell you an answer you might not want to hear. It's not sexy, exciting, or controversial. The answer is gray, muddy, and unclear. If I had to make my best bet, then I'll tell you that I'm still going to recommend icing after an injury or surgery. That's the best of our current knowledge. Like your mom always said, everything in moderation. So some takeaways from today. The use of ice for injuries has been debated, with proponents citing its ability to reduce swelling and pain, while critics argue it may interfere with natural healing processes. Recent studies, particularly on knee replacement patients, show that icing can lead to shorter hospital stays and less pain medication use without evidence of slowed healing. While the evidence is not conclusive, I still lean towards using ice for injuries and post-surgery, but in moderation. So there you have it. This is a perfect encapsulation of what we deal with daily in medicine. As much as we'd like to believe it's a science with black and white answers, the reality is that we are left making decisions with the best available information. These decisions are always easier if you understand the risks and the benefits. Then you can choose what's right for you. Thanks for being here today. We'll see you next time.